I'm actually a fourth generation Tyler native. They came in Reconstruction. And I've had patients who knew various members of my family going back 100 years. I had a patient that was 104, and she remembered my great-grandmother who married in the early 1870s. I'm a big eBayer. My wife periodically grounds me from eBay. So I'd say most people are surprised at that. Dr. Pat Thomas and Dr. Dwayne Andrews had operated on my grandfather, and he had a complication in the ICU, and they resuscitated him here at Mother Frances. And I was so impressed and grateful for what they'd done for my grandfather and my family that I wanted to look at medicine as a career. I was in Baltimore, Maryland, and we actually thought about staying, but we were anxious to come back to Texas, and a very prominent physician who actually took care of my grandparents was ready to retire. He had trained at the Wills Eye Hospital. He was one of the first in Texas to do a corneal transplant. And so he was ready to retire and wanted me to take over his practice. It's reputation, the outstanding physician panel that they have. Is to treat patients exactly as I would want to be treated, or if it were a member of my family. And I'm opinionated enough on most subjects that I usually have a definitive opinion. I try to not project that onto people and explain my reasoning to them. But I always feel good about what I do because I do relate to my patients as family. I'm especially excited about the equipment that Trinity Mother Frances has purchased for me. We have the latest Zeiss Ophthalmologist microscope, which is the best one available, state-of-the-art. It will make my job easier and improve my visibility and make it safer for patients. It's a powerful experience to be a part of a patient's life, where their trust and their confidence in you is really an emotional experience. And their gratitude is a wonderful thing.